So we're here now at the end of the CRT that we've had on in environmental sustainability, and I'm here with Professor Paul Dendale. Paul, we've heard you talk just now about how we communicate environmental risk to patients. What would be your 3 key takeaways for any cardiovascular professional that might be communicating with patients around environmental risk?
Well, I think the main thing is to be aware that our climate has an impact on the patient, so that we need to change our medication. We need to give them advice on what exactly they can do to cope with the problems with heat and extreme cold. But on the other hand, not create anxiety in the patient. So that can be done by giving clear coping strategies. So if you explain to the patient what is the mechanism of the impact of climate on their health, but how they can react to it to make sure that it really minimizes the damage that it has, that will have an impact on the patient. And in the same way, we will have the patients being also advocates for healthy environment. And I think that's a very important aspect. If our patient groups also speak up about environment, we will have more impact in products, I think.
Yeah, absolutely. I think that patient advocacy element is so crucial. If this video is seen by a patient, what would you want them to do to try and advocate for better environmental conditions?
Well, I think speak about it, spread the message. I think that's important, because so many of us do not know that environment impacts patients, and so I think that's the main thing. If they can spread the message so that it is supported by a large group of people, then politicians will listen.
Thank you so much for chatting with me today about that. Thanks.